In today's health alert, COVID-19 summertime spread shows no sign of ending. According to recent data from the CDC, many areas of the country are experiencing consistent increases, with emergency department visits up 23.5% during the week ending July 6th. Our chief health editor, Dr. Nandi, joins us with more details on this. And Dr. Nandi, should people be worried about this again?
Yeah, it's just seems like it's never kind of going away. But let's talk about this. Emergency room visits due to COVID-19, Linda, have been on the rise for weeks. And we talked about it earlier. The numbers are up substantially in 26 states plus Washington, D.C. The states that are experiencing the greatest increase in ER visits involve COVID-19 were Mississippi, up 83%, Rhode Island 55%, Idaho 45%, and right here in Michigan 41%. Now, it's not unusual, right, for COVID-19 cases to climb during the summer. People like to travel, and because of the heat, we also spend some time indoors when it's super hot. But should people be worried, right? I mean, we talk about COVID. Should we be worried about this? And what really varies depending on your health and medical conditions. Many recover from COVID-19 at home, but for some, it can really lead to severe illness. And we've seen that. Particularly at risk are older adults age 65 and up, who, by the way, are currently being impacted the most, unfortunately, according to the CDC. Others at high risk include those with compromised immune systems, people who are diabetic, HIV, infected patients, or people with multiple underlying health issues affecting the heart, the lungs, and the kidneys. Now, we don't know all the reasons why COVID-19, Glenda, is hitting some harder than others. So if you have any health concerns, hey, please talk to your doctor to assess your personal risk.
So what should we do to reduce our chance of infection, Doc? And should we get the current vaccine, or there's an updated one on the way?
Yeah, important questions, right? So the CDC is recommending, and I agree, several measures to protect against COVID-19. First, stay up to date with COVID-19 vaccines. It really is effective. Practice good hygiene, like washing your hands often, covering your sneezes and coughs, and cleaning frequently touched surfaces. Improve indoor air quality by purifying indoor air, changing air conditioning filters, and gathering outdoors whenever you can. And wear a high quality mask like an N95 to reduce the number of germs you breathe in or breathe out. It's also important, right, to test for COVID-19 if you're sick. A lot of people have been sick recently around me with my patients. Rapid antigen home test, very convenient, although not as accurate as a laboratory PCR test. If you test negative initially, you still are sick, you can retest the next day to double check. And if you're sick, regardless of COVID-19 positive testing or not, please stay home away from vulnerable people so you don't get them sick. As for waiting for the updated vaccine, right? This should be available in September. I'm going to get the updated vaccine. So it makes sense to wait for that if you're currently up to date with your vaccines. However, if you're in a vulnerable population, right, please consider taking the additional precautions I mentioned, and don't hesitate to ask loved ones around you to do the same. This is how we can kind of get through this. Again, we've been through it before, and I think we can, if we pay attention, do the right things, we can get through it again.
All right, Dr. Nandi, appreciate it. Good to see you. Thank you.
Same here.
If you have a health question for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or Twitter. We'll get it right to him.